Hello, good afternoon. You cannot minimize them and you're okay. Hello, good afternoon, everyone. For everyone present, I have people online as well. So pardon me if you see me looking into the camera, and everyone on the camera, we have people present in the room. I will look up at everyone in the room as well. I'm just going to pull up the information and speak with you regarding the Certified Nurses Assistant Program at the Bermuda College, which will fall under dual enrollment, as well as touch on the EMT program as well. Just a minute. We just had to make a slight adjustment. Now, the course at Bermuda College, I think this upcoming cohort will probably be, I want to say cohort number 10. I just had a conversation with the team at Bermuda College prior to coming. And so far, I'm going to tell you right now that the program has grown. Our students have been benefiting from the program, jobs, helping with college and career and next steps. So I want you to keep in mind that even if you're looking at, I don't want to be a nurse, but this is my starting point, there's so many other opportunities to start this program and branch off into other areas in the medical field, but also don't negate education as well. So some people have built upon it. So this program was actually developed for working adults, and it became part of, as people were working with the adults, they said, you know what, we need more nurses. It's a shortage of nurses internationally, worldwide, all over the world. And they decided, how can we get more people into this field and more Bermudians working in our hospital in Bermuda, as well as working with our vulnerable people and people like the elderly and the sick. And they developed this program in collaboration with Bermuda College, the Bermuda Nurses Council. They're very much involved. So you start making connections and networking in advance, and also workforce development. So with this program, the participants, you would always cover learning key and basic things. And this is for the EMTs as well. There's still basic things that the EMT would need to learn. And that's the vital signs, medical terminology, caring for our seniors, and I spoke to that earlier, seniors and vulnerable people, professional regulations, because there are laws, even though you are a young adult, you're transitioning into young adulthood, you're still going to be held responsible. So I will tell you, initially, we started this program, you did it for 2 years. You started in S3 and completed in S4. But as we had more and more cohorts and our instructors changed, we now were able to take the program down to 1 school year. And that's why you do it in your senior 4 year now, because you have to be, by the time you finish or shortly thereafter, you should be 18. And that's the only time the Bermuda Nurses Council will provide you with a license. So when you complete this program, you're actually prepared to work right in healthcare. You have hands-on experience throughout the program. So there's lectures, then there's also clinicals where you'll go and do practicums, but there's also a lab at Bermuda College. So it's not all lecture, it's hands-on. And typically the meeting days so far, students used to leave campus half day, certain days a week, but now we changed it because we didn't want to interfere with your senior year, your last year of high school, where lots of things are going on. And I have to be clear with you, there are going to be some things that you have to miss when you decide to take this program, but we'll speak about that a little bit later. In this program, you now will attend class Wednesday evenings and Saturday mornings. So that way it does not interfere with your academic program, but I will tell you that it has posed some challenges for people who work weekends and who may be in extracurricular activities. I will always also say that whenever a student has told their immediate supervisor or the owner of the company, or if they've told their coach or dance instructor that I'm doing a certified nurse's assistant program, pardon me, while still in high school. I'm a dual enrollment student and I still want to be a part of this. They actually find ways to accommodate you. So don't write it off by thinking, oh no, this is going to clash with that. Really take some time to speak to what you're doing, your goals, your dreams, your ambition. And your academic plan with them. And if you need help, you have people right here in this room that can help you either frame that information or help your parents frame how to have that conversation, or we can have the conversation with you and the other, and the supervisor or the coach. Okay, so don't feel that you're by yourself when you have to let them know. One of the basic things is that, we used to just sign students up, but recently they want Bermuda College is seeking data. So you can sit the oh my goodness, CPT. I was going to call it CAT. I knew it wasn't CAT, but the CPT program. And I think that's really a good practice for you, because we can make a case for anyone who wants to join the program. I've taken students who may have been considered learning support students, or students who need extra help, who need extra time, who need accommodations, and we've made a case and they've found success in the program through commitment and support. I believe it's more informational because we can go around that. So, right, it's not gonna. Exactly. And I will tell you that they have made changes, and I will speak to one of the major changes that I found out this morning. So I can confirm the CPT. I just know it's not going to be used. It's something that will not be a barrier for you to enter this program. It's always good practice, but it's not going to be a barrier. So I definitely want you to know that some of the areas where you can work once you have this is either long-term care, working with healthcare agencies, hospitals, a rehab center, facility, the hospice, clinics, adult daycares, as well as community health. So really, I think they really want to know more or less that you are competent in English and math, and we know that you all are. So I don't see the only thing that's going to become the barrier to you going in would be you yourself as the individual. So this course is 2 semesters. It starts in the fall, and then you have another semester in the spring. You're on the Bermuda College schedule. And within the program, there will be, like I said, there's coursework, and then there's also practicums. You will learn more about what those look like, but I have given you the basic days. There are going to be times that there are mandatory clinicals. So there's so much time that you could miss from the course. From the program, they will let you know how many absences you can have, how many will be excused. We know when it comes down to cotillion practice, that may become a conflict on the Wednesday. But again, like I said, whenever there are conflicts, you will have myself. Definitely, I'd like to introduce you to Miss Jacobs. I don't want to say the first name. And you already know you have your counselor. So you have a group of people to help support you to navigate that. The second semester is really, this is where you do more a blend of the book work as well as hands-on. You'll see the first semester may be more lecturing, exposure, but the second semester, you're more hands-on, you're more immersed in medical fields, medical settings, and this is a wonderful opportunity to start networking with professionals. They're watching you, and we already have we reconnected with Leafroy House, and they actually asked for the high school students. And so you need to know that there are adult learners that take the same course simultaneous with you. So that cohort will run in the evening. You're not in their classes. You may see some come to some of your clinicals, or you may need to rearrange to join some of theirs or some of the classes. But typically, the high school students are by themselves, and the adult learning students, they're separate. Now, let me give you when I tell you about the clinical capstone, that's the one you definitely don't want to miss. So you need to make sure that when those dates come out, if there are family travel plans or different things going on, school trips, please identify those dates as early as possible, because that clinical capstone is mandatory for you to pass the course. And then and it's a full week from Sunday to Sunday. So you're working your shifts, but you'll be working, your instructors are nurses or nurse leaders in the hospital, so you are well prepared for doing this. Now, let me just tell you about some of the requirements. We talked about the CPT. We know that the CPT is going to be a practice test for you, and that's a formality, and that's just data collection. We know that you already have the grades to join the program. We know your college level English and math. I think that you're well on your way with that. And so for some people, an associate's degree. Right now, for our high school students, we need you to be committed. Your requirement is that you're committed to your success, that once you join the program, you're going to have some other things about your personal life that you're going to have to be mindful of. And I think that may be one of the biggest requirements when we start looking at the vetting. And so when I say that, you're going to be required to have a police vetting form. And the reason why you have the police vetting form is because you're working with the elderly, you're working with vulnerable people, the sick and the elderly. So that form you can actually go to magistrate's court since you're a student. And that is like I think that one was $10. They may have increased the price. You will be required to take a drug test. Again, even working at King Edward Memorial Hospital or working for the Bermuda Hospital Board and different healthcare settings, they require the drug test. And it's not a urine test. They're going to take like a small little piece of your hair in the back. And all of our students have done it. I have to give you the disclaimer. If any of you have had edibles or anything like that, where you have any type of drug in your system, I recommend that you take this time over the summer to cleanse yourself and try to take your test in September. Okay. So we don't need to know who it is or what's going on, but we do need to give you the support and the advice on how to overcome this barrier so that it doesn't prohibit you from being in the program. Mm-hmm. So you would have to start now, cleansing yourself, and be ready to take that hair follicle test September, no later than October. We can't push it past that, okay? Also, we need to have proof of health insurance, and you're all students, so typically you'll be on your parents' health insurance. You'll have to take a TB test, tuberculosis, either with your doctor, pediatrician, or you can go to the clinic. The hepatitis B test and shot, a tetanus shot, the flu shot, the SCARS training, which is taking place now. So for those who are in SCARS, you're ahead of the game for that. The regular COVID testing, and then it's the American Heart Foundation CPR and for healthcare providers. So I know we have first aid and CPR here at the school, but that course is not the same course that you'll take to enter this program for healthcare professionals. And so the application process, the application is online, and all you need to do at the bottom of it is to make sure that you type in your name and your date. We'll accept your name as the signature. Now, let me hop over a little bit and show you the parallel with the EMT program. This would have been our third cohort for the EMT program. We've been waiting for that for quite some time. And after they've worked with a few cohorts of our high school students, and I made a I advocated for that again today, that something needs to change about how the delivery, because it's one semester and it's lecture based. We're looking at what that looks like. So that course will not run in September. But I do recommend that you consider, we have had males do the Certified Nurses Assistant Program, CNA, and we've also had females show interest, or I've seen females in the adult class for the EMT. The pathway for those who wanted to do the EMT, I really would recommend that you consider doing the CNA, because that's a foundation course and program and certification that is very much international. And then you can branch into the EMT. By the time you finish that program, will be back running. So I really don't want you to put aside your career goals, because when you think about the pathway, in medical field, you can start off with the certification and then you start building yourself up to the next level and the next level. So it's still part of your pathway. It's just taking you in another direction. If you were interested in becoming a firefighter or even working on the ambulance, then having the CNA is actually a bonus, because now you can work right there with the ambulance. You can be an EMT with firefighters, or you have the life-saving skills to just go and be the firefighter. So it just still gives you, and if you need more time with either one of us, or Ms. Massini and myself, we can definitely show you how this course will help lead you to in the multiple pathways. We've also had a student who did the CNA. She utilized this on her scholarships application, and it was very favorable. It's been very favorable to have dual enrollment, especially an international certification on your resume, in your toolkit when you're applying for scholarships. And from that, some people have gone on to become a former student. She's actually now an educational therapist. So she used this, went to college, used it to get scholarships, came back, worked for the prison service in the psychology department, and then transition into education. So you can actually use it as a foundation, or let's call it a key to unlock doors and opportunities in multiple careers. And if you want to speak with us, we can show you where you want to go and how to bring it back, work backwards to that CNA program. I don't work for Bermuda College. I know I said good morning, but my name is Tammisha Francis-Wainwright, and I actually work for the Department of Education. So I'm not marketing for Bermuda College. I just know what I am marketing is an opportunity for our students to receive a credential and get on with their next steps while they're still in high school with a supportive team. That's what I'm marketing. I've spoken for quite a bit, hearing my own voice. Does anyone have any questions?
Hi, good afternoon. I have a question about the CNA
Yes, ma'am.
course, and I wanted to know. Hi, I wanted to know if it was a course that was offered at Bermuda College for my son to do, or if it's something that he has to do on his own. I was kind of like in the middle of a classroom when you were talking about the CNA program. I don't know if you mentioned it before. I'm sorry.
Okay, no, that's fine. This is a dual enrollment program. So it's held at Bermuda College. The program is run through Bermuda College, and the lessons are taught on Bermuda College's campus.
Okay.
And for our high school, pardon me?
The CNA?
Yes,
CNA?
the CNA,
Okay.
yeah.
Okay.
And I would actually, I'm going to put in the chat, I'm going to just put a link in the chat so that you can go directly to Bermuda College's website. That's where the application will be. However, as far as the money, it is absolutely free of cost to our high school students. The Bermuda government, the Department of Education, take on that responsibility to pay for you to attend. Yes, ma'am. No, even the adults won't get paid for the clinicals. It's just part of your program, but I will say that it's an opportunity to demonstrate your skill set. And I think they're gonna call you back so they could pay you next time. Yeah. So you have that opportunity. People are getting paid minimum of 20 to $25 an hour are young people. So that even helps when you come home for the summer. So summer employment, when you have that credential, you can come, say you decide I want to go and do accountancy, but you can come home for the summer with your credential and still make your money over the summer and make excellent money. So that's a way to help yourself with that. Yes, ma'am.
Yes, good afternoon. Thank you for elaborating. My question is, I heard you say that this is going to be fully covered by the Bermuda government. Is this for class and books, or would the books be something separate and apart from the consideration of the course?
This is an excellent question. Actually, the course is paid for, and so the actual course roughly is about 3,000. Let's see, I just had that price. The price is moving up. It's $1,795 per semester per student. And so the government pays for the course, and the parents will be responsible for the books. And then there will be the uniform. There will be a further orientation, or there will be an orientation for the students who want to be in the program. So that'll speak to the uniform, the stethoscope, the watch, and different things like that. It's a kit that they purchase at Bermuda College. They also wear like a red scrub. They have a red scrub top identifying themselves as a CNA student. And so it's also what pants they're to wear, white pants and white shoes. So that's for those who are, this is the overview, but for those like more details that if you want to proceed with the program, there will be an orientation at Bermuda College for all dual enrollment students on the 19th. And also within that, our CNA students will have time away from that to hear more, and then there will be an opportunity for a parent session. Hello, sir.
Yes, thank you. I'm just
Okay.
taking very much.
Okay, just making sure I covered all your questions. Anyone else? Actually, the credits don't, so about the credits, when you complete this program, you will actually receive 1.5 credits for your work in the program. That comes towards your high school transcript. However, when it comes to those who want to attend school in the UK, if you're going into the nursing field, the CNA permits you to interact with patients sooner than those who actually are from the UK without it. So Mrs. Seymour's daughter was one of our earlier cohorts, and she explained to me that her daughter was actually one of the few or the only able to interact with patients and start working immediately in her nursing program because she had the CNA already. So it does give you access to other opportunities, and it does help when you go to college and university. We know for sure in the UK, and I'm certain because you're accredited through the US, that it may have similar opportunities.
Yes, I have one more question.
Ask away, sir.
In regards to students that may have aspirations to go higher or further in the medical field, say for instance, to be a doctor, are there any partnerships that this program has with any other schools in other jurisdictions where the credits are transferable?
Well, because it's a CNA program and if we were in the US, it would have been part of it's a certification. So it's one of the certification credentials. Some schools may accept it, or like I said earlier, they may use it as a stepping stone for access. And it definitely helps for scholarships. That's been, for the past 10 cohorts, that's been the feedback that we get from our alumni. So I would say even Bermuda College, if you continued in their like they have a nursing program, the credits haven't transferred over within the same college. So that's where it becomes more of currency to access. Sorry about that, everyone. It just dropped out. I hope everyone comes back. And
Yes,
okay, you're there.
unfortunately, when it dropped, you were in the mid of explaining that it assists with them with their pursuit academically in the medical field, and that's where it dropped off. I was just querying or inquiring if there was any partnerships of any other schools where the certified nursing aid certificate, if those credits can be transferable to another institution.
So far, we don't have any data on that. So even in the full nursing program at Bermuda College, it's not transferable. If they were to go into the nurse practitioners program at Bermuda College, they start with their credits fresh in that program. It's been more of supporting for scholarships, jobs, and currency for access, more so than the credits. And it also helps with prior knowledge.
Okay, thank you very much. Thank you.
You're welcome. You're welcome. And I believe that at Bermuda College with the book, the EMT book was very expensive because it involves so much and it's something that you can use as a manual in your work. So that book was $600 and something. I think for the CNA, I want to say maybe with all of the exams, you know, when you have to go and pay, you have to pay for the testing. It's only held at BHB down at King Edward. So that's like $100 and something just for that test. So it becomes maybe on the parents' portion. I don't believe a parent pays more than $500 to $700 for it. Outside of that, the government pays over $3,000, almost near $4,000 for you. And I can get the exact prices by the time you get to orientation next week for those who are interested. And if anyone needs any help, if you're sitting here saying, we're not going to be able to pay for that book, we're not going to be able to pay for that test, that's going to bring extra burden on my family. Come in confidence that we will help you. We won't tell anyone. We will not share that you're in that situation. No one will know. It will just be between us and your parents. Okay, so do not let money become a barrier to you pursuing this opportunity. It's not about the money. It's about the individuals. It's about your opportunity. Okay. So if anyone wants to reach out to me, my cell number is 533-1902. My email address is TAWainwright, WAINWRIGHT @barclay.bm. Yes, ma'am. I have one more question. Yes. 533. Yes. Yes, that's fine. Yes, that's fine. 533-1902. Okay. Any other questions before we go? Okay. All right, to everyone online, thank you for bearing with us and thank you for your questions, your interest, and your support. Please reach out if you have any questions again, and I thank you for your time. I'm sorry, application deadline is tomorrow. You can email name and interest, and we will help email the name and interest to Ms. Massini, and her and I will collaborate, and we'll ensure that the applications get to Bermuda College. Any questions, ladies? The orientation at Bermuda College is on the 19th from 9:30 to 10:30. I mean 12:30, sorry. And they will serve lunch, and you will actually get to meet students that are currently in the dual enrollment program or who have completed the dual enrollment program. So you'll hear from your peers. Yes, ma'am? It'll be just students for this one, and then we'll have the parent and student session. It'll be another date. And PACE, the PACE department who facilitate the course, they will let you know that at that point. Because I know, and parents may have questions. So if you have any immediate questions prior to that, your parents can reach out. Okay. Is that it? Okay, thank you again, everyone, for your time. We're here for any question, no question. The smallest question, it does not matter what it is. It could be what days again, it could be a repeat. Feel free and comfortable to ask any questions that you have about this opportunity. Okay, thank you so much. Take care, everyone. Bye-bye. You're welcome.